in this realm of things, if you have implants, it's going to be very difficult for you to be 100% healthy. You may be able to get by, but you're not going to reach 100% optimal function because you have something foreign in your body that is not yours. It does not belong to you. All right, everybody, welcome to another episode of the Doc Jock Show. Today, we're going to be talking about a topic that is something that has been, I would say, a big buzz for the past maybe 2-3 years. And it's been something that a lot of women have been suffering with, a lot of women have been experiencing, and they never really knew where a lot of their symptoms were coming from. But there was a big, huge, no pun intended here, breast implant resurgence, if you will, where a lot of women were getting breast implants. And what we're going to talk about today is breast implant illness. Now, the tough part about this, right, is we have implants for the cosmetic aspect of it, right, where you just want to make them look better, or you have some sort of an insecurity with how big they are, how they're shaped, etc., and you want to get them fixed, or you want to get them done. Then you have the other side of things where there are men who are trying to transition into becoming a woman and they want to get breast implants. And then you have people who go through cancer and they have double mastectomies. And so then they put breast implants in replacement of where their original breast tissue was. And so this is kind of an oddly all-swooping topic where if you're thinking about having implants, if you currently have implants, this information is information you should absolutely be aware of before you ever even think about getting implants in. Now, this is something that I've been working with. I've been treating a lot of patients over the past couple of years with breast implant illness. Encouraging whatever it is on their journey. If they want to get them taken out, get them taken out. If they want to kind of suffer with it or see how good they can be with the implants in, that's up to them. But there's always that knowing that, hey, listen, as long as these things are in, they are causing some sort of low-level inflammation in the body, because at the very least, it's a foreign material in the body that the body does not recognize. If the body does not accept it as you, your body will wear and tear that thing down. And that's where a lot of these illnesses can actually come into play. And the capsule that they actually put the implant in with, it starts to deteriorate because your body again starts to wear it down. There's wear and tear, there's degradation to the wall of it. And so whether you have a saline or you have silicone filling to it, you can actually leak that fluid out into the system. Right? There's so much to this, and there's tons of research on it. I pulled it from all over, from Cleveland Clinic to Mayo Clinic to just regular articles that I'm able to pull out through PubMed. We're going to go through all of that today because I want this information to be at your fingertips so that, again, if you need this, or if you need the information, or if maybe you're a husband, you're like, oh, my wife has been dealing with a lot of this stuff. She got implants, the beginning of this year, and she feels terrible. Or as soon as she got implants, she started having these symptoms. Or they had them for 10 plus years, and these symptoms are coming out. She's on multiple medications, and now we're on, the medical crutch where we need medications to treat the symptoms that are caused from these breast implants. All right. So just fundamentally speaking, what is breast implant illness? So the generalized accepted term or definition is a collection of symptoms that occur in people with breast implants. This could be something like fatigue, joint pain, brain fog, autoimmunity, dry eyes, hair loss, infertility, depression, anxiety, insomnia, mold in the body. So it'll be tested high for like mycotoxins. And so just as like a quick pause on that, how many people are just suffering with those symptoms just on a daily basis without any breast implants, right? So the breast implant illness can be very sneaky in terms of how we diagnose this, right? Say a person has chronic fatigue syndrome and they're like, listen, I never used to be tired. Now I'm tired all the time. Could be that your adrenals are zapped, but it could also be because you're developing black mold or fungal infections inside of your breast capsule or your breast tissue, and that's causing your body to be constantly inflamed, which therefore is causing your adrenals to be zapped, or you to have brain fog, or you to have a higher risk for breast cancer. So there's a lot of this, is it breast implant illness? Can we sneak and say that it's not? And so some of the research will try so hard to say, oh, it's clear cut. There's no causation between breast implants and cancer, or breast implants and breast implant illness. It's been disproven, it's all bullshit. Like, when you look at this, like, it's going to cause inflammation in the body, and anything that causes inflammation in the body can then further down the line contribute to things like cancer. So you can't say that there's not a causation. You're like, oh, there's a correlation. It could potentially, but as long as they're in the body, they are creating harm. They are creating inflammation. So we need to be aware of what this portrays as or what this could be doing to our body. Now, we can have different things that take place in terms of like the serious conditions, right? We talked about some of the basic symptoms, but you can have what's known as a capsular contracture. Okay. Capsular contracture is basically when you put that implant in. Okay. You put this implant in. This is a tape measure for those of you who don't know. You put this thing in here, and what happens is your body doesn't really recognize it. So it actually starts to cause this like capsule, or this film, if you will, that goes over top of it and kind of covers where the implant actually is. Okay. And when that happens, it's called a capsular contracture. And what's going to be caused from that is a lot of inflammation, obviously. But we're going to have this happen about 11% of the time with breast implants. Now, these are for people that are actually aware of it or are curious about it. How many people have implants in and have never had any type of maintenance work done? They got them in. It was an expensive thing back then. They never really got them replaced, worked on, checked out, or anything, right? And then all of a sudden, you get older and you get the symptoms of becoming older. And they tell you it's just because you're becoming older, when in fact, it's because you have breast implants. Capsular contractures is exactly that. So what you're going to get is the infection. You'll have bacteria that will basically come in, and that's what will kind of make that shape or whatever, if you will, or a biofilm. For those of you who know what biofilms are, it'll create this biofilm around the actual breast tissue itself, or this the silicone or saline, whatever it is. And then when we have that take place, we're going to have massive inflammation, chronic inflammation. We can have different types of cancers that are actually contributing from this as well. One of which is considered ALCL, which we'll get to what that is. It's breast implant associated anaplastic large cell lymphoma, or cancer, due to capsular contractures. So, with the rate in which people are being diagnosed with cancer, we don't really want to do anything that is going to contribute to that risk. Just had a call with a phenomenal patient today, and she's like, I found out that my toothpaste had a cancer-causing agent in it, and I didn't want it. So she had to gut her toothpaste now, and she's working on her shampoos and things. So all of the stuff that we put on our body, in our body, is either going to lead to health or it's going to lead to death. And it's our choice to figure out what we want to put into our body. It's our choice to decide that. Now, when we have the capsular contracture, again, this is something that could take time to develop in our body. Cancer could take up to 10, 15 years sometimes to even be detected. So this whole time you could be building cancer, and they could get away with saying, no, breast implants aren't causing cancers because there's so many different variables, environmental factors, right, that can get in the way and make you feel as though you have cancer. When you're like, it's not the breast implant, it's going to be this, it's going to be that. Or they just scare you so much that you don't even really care. You're like, just treat the cancer and figure out what we do from there, right? Now, the whole BRCA gene thing, BRCA mutations, and the Angelina Jolie rip them out because I had the BRCA gene and replace them with breast implants. This is not a smart thing to do. And we actually got into, I'll bring it up. Megan, sorry. So Megan and I were at a certain location. I won't be super specific with it, but they were talking about breast implants, and we're educated on this just a couple of years ago. And we were like, no, breast implants are terrible for you. They do this, they cause this, they can cause cancer, they can cause this. And this woman had just had breast cancer, got her double mastectomy, and it was scheduled to get implants put in like 2 days or something. And Megan slipped into that conversation. I was like, well, that's not a good idea. Whoever does it's not a good idea. And that was her. So anyways, you should be aware of these things, because if we're trying to treat cancer and we're like, well, if you have breast cancer, let's rip the breast out, and then you put something in that's going to increase your risk for another cancer, why would you do it? Why would your doctor even allow you to do that? That's not good. It's not healthy for you. Foreign agent, you're causing inflammation by ripping the breast tissue out to begin with. You didn't get breast cancer because you have breasts. You got breast cancer because of diet and lifestyle. Okay? Know that it's because of diet and lifestyle. Let's fix it. Right? So if we're putting in implants, we're putting in inflammatory tissue in an already inflamed environment, you're going to develop more issues. You're more than likely going to have more of this capsular contraction where the bacteria is going to encompass that thing there. And then all of a sudden, we're going to have symptoms that are correlated with that or that are caused from it. Okay. Then you can have the unfun one that a lot of people will joke around about this, but you can have one rupture. So whether it's saline or whether it's silicone, they can leak into your body. Neither one of them is really good for your body because saline solution is going to have a certain solution to it. And then, heaven forbid, silicone's toxic. Well, for the most part, silicone's toxic. The encasement, whether it's salt water, whether it's saline or whether it's silicone, the casing is still silicone. So you're going to be leaching that into the body, and then you're going to leak the actual fluid into the body. It's not good, and it could take time before that's detected. Otherwise, you can see it. There's some sort of abnormality or deformation or something being deformed in the breast tissue. You're like, oh my gosh, like maybe something's going on. And then you go and you get checked out and you find this out. But here we go, right? So you can have it rupture. Signs of a rupture is going to be fatigue, myalgia, so joint or muscle pain, joint pain, dry eyes, or they call it Zika syndrome. You can have synovitis, which is inflammation to the joints, rashing, alopecia or hair loss, muscular disease, lymphadenopathy, or autoantibody formation, which means you're creating autoimmunity. So another sign, like when do you know that you have breast implant illness? You're like, oh, I ruptured one of my breast implants and now I have an autoimmunity, right? And what is the medical realm going to do? They're going to push you on an immune suppressant or an immunosuppressant to suppress your immune system, which is then going to leave you more at risk for developing secondary infections. And what if you have infections that are in, or that bacteria that's in that capsule, right? And you don't get that treated. And then all of a sudden you're filtering all that stuff through your body. You don't have the antibodies. You don't have the strength to be able to kill it. You don't have the strength to be able to do it. And then guess what? You're going to have a weakened immune system, which is going to lead you to a higher risk of cancers, right? It's a beautiful layout. What do you think of it? Okay. And I don't think this is their intention when they first came out with implants, but this is something that needs to be talked about, needs to be addressed. Okay. So what else can be a serious condition? We talked about the BIALCA, which is a breast implant associated anaplastic large cell lymphoma. You can get Sjogren's disease. You can have another autoimmunity that takes place. You can have polymyositis, which is basically multiple muscle tissues are going to be inflamed. You can have mixed connective tissue disease or disorder and other cancers that can take place. You can also get, one of my favorite topics, you can also get black mold in these things. You can have fungal infections. You can have mold actually physically growing in the capsule itself, which is disgusting. If you go on any Googleable search and just type in mold in breast implants, and you'll see these black breast implants. They're disgusting. And that's going to be gently leaking into your body, and it's going to create inflammation. And again, it's going to create disease in your body. So this, again, it's so sneaky when you have breast implants, but like at the end of the day, you're like, hey, I've got all these rashes. I got this, I got this, I got this, I got this. Look at those implants. See what's going on there, right? There's also a relationship between silicone breast implants and chronic fatigue. So silicone implants, chronic fatigue, arthralgias, myalgias, pyrexia, Zika again, which is the dry eyes and cognitive function. You're also going to create autoimmunity. You're going to create inflammation, autoinflammatory syndromes. Saline versus silicone. Saline is basically going to be your salt water, still going to be wrapped in a silicone capsule. Okay. So it's going to cause inflammation. It's going to cause your body to have to adapt to the different materials being in your body. You're going to be stretching tissues. You're going to have decreased range of motion. You might have painkillers that the doctor gave you, which is going to harm your body. You may have IV antibiotics or antibiotics that they're going to give you because you open up the body. You want to make sure you don't get an infection, which is then going to decrease your gut health function. So there's a lot of this that stacks into this. Okay. The other thing we got from Cleveland Clinic, symptoms of breast implant illness. This is another, the whole theme of this is so hard to diagnose, which makes it so easy to say that breast implants are not causing this to take place, right? Because it's not like, hey, if you have breast implant illness, you have a red nipple, right? It's not that easy. Like if you stub your toe, you're going to have a red toe. Every single time. Every time you stub that toe, it's going to be red. It's going to swell up. It's going to be red. Or you twist an ankle. It looks a certain way. It's easy to diagnose by that clinical criteria. When we talk about breast implant illnesses, we're talking about cancers that can go undetected for years. Okay, we're talking about autoimmunity, which could also go undetected for years. We can talk about gut dysfunction, just joint pain, where you're going to the chiropractor 50 times a week and you're still like, I am so inflamed, or your chiro is like, you're not holding your adjustments. What's going on? Could be breast implants. So because they're different from person to person, makes it so unique on each person's journey. But I can tell you that 100% of the people, 100% of the time that get these things taken out feel better upon explant. 100%. I have not seen one person who is upset that they got them out. Now, different things can happen. Common musculoskeletal symptoms. We talked about the joint pain, muscle pain, and myopathy. All right, this one's from Cleveland Clinic. We can have cognitive symptoms, anxiety, depression, okay, brain fog, fatigue, memory loss, trouble concentrating. And we have common systemic symptoms, autoimmunity, and chronic pain. We can have dry eyes, low vision, hair loss, skin problem, rashes. Okay. So I know a patient who got breast implants in, and this is where, women will do like the mommy makeovers. They'll get like tummy tucks, they'll get breast implants or breast lifts. And what will happen is soon after you develop these symptoms, and the doctors are over there like twiddling their thumbs. They're like, well, we got them in, we did our part. And then to get these things taken out is more expensive than it was to get them put in. That's how ridiculous this is. And so people will have rashes, people will have pimples, people will have hormonal dysregulation. They'll be like, oh, my period is crazy ever since I got this mommy makeover, ever since I got these implants, and what do I do? Right? And it's 100% of the time. I don't care what you believe. At this point, I don't care what you believe in this realm of things. If you have implants, it's going to be very difficult for you to be 100% healthy. You may be able to get by, but you're not going to reach 100% optimal function because you have something foreign in your body that is not yours. It does not belong to you. So you get these mommy makeovers and you get these breast implants, and then you have symptoms of rashing, right? And then you have symptoms of depression, anxiety. It's like, I already dealt with postpartum depression. Now I'm having anxiety and depression on top of it. It's just making the situation worse. So this is a bunch of snowball effects that can take place in the body. And we can't have this happen. We can't let this happen to the women that are out there. And I get it, the cosmetic side of things, and they're trying to be body positive and not promote obesity, but promote obesity, and don't promote skinniness, but do promote. So much confusion out there. All I'm saying is just be you. Be the healthiest version of you. Be what God called you to be. Be that healthy version. And if you do that, your body will thank you for it. Your body will give you abundant life. It'll give you abundant vitality. And you will love it. You will love it so much. The other thing that makes it super tricky to diagnose breast implant illness is that there are no tests. There's no way to test, do I have breast implant illness or not? The only way to do it is go in, rip them out, see what you got. If you have fungus, you could test you could do like a biopsy if you want to of any type of bacterial tissue or damage that's in the actual capsule itself. Or you can test the implant, see what that looks like. The only way you can tell if they're bad is if you get them taken out, if you already do the explant surgery. Pretty ridiculous, right? So again, really difficult to diagnose. Okay. Now, sometimes what they'll do is you'll have people and patients who will just constantly suffer with joint pain, and they'll think it's arthritis, or they'll think it's Lyme's disease. Okay. Or even mold toxicity, right? Because you can get mold in those tissues in the breast implant, and you keep testing, and nothing comes back. It's like a positive find due to not being able to find positives anywhere else. Then you're like, hey, maybe it's the breast implants, and they take a look. Okay. And then they find it. So it's really important. It's really, really, really important to know this topic because of how common these things are. The other thing that's really important to note is when you get these things taken out, when you get the breast implants taken out, sometimes you can notice changes within 30 minutes of being out of surgery, the first day of being out of surgery. But typically, the symptoms and diseases that you had going into the explant are going to be eradicated for you. However, what's really important to note is some of these diseases do not go away for some people. So before you think to get implants in, make sure that you know the risks that are associated with this. Talk to your doctor about this, not to sound like a cliche commercial, but talk to your doctor. Bring your concerns to your doc about this. You're messing with the anatomy of the body, and anytime you do that, you are going to be triggering inflammation. And if your body is not capable of handling any more inflammation, then your body is going to continue to be broken down. So those of you who are out there and you're on your journey, or you're dealing with weird symptoms, or you're like, I don't know where the heck this is. I've got a positive mycotoxin test. There's no mold in my house. I've never lived in a moldy environment, but I do have breast implants. Maybe get those checked out. And maybe find a doctor like, listen, I really want to get these taken out. What's the cost going to be? And start saving to get them taken out. We're talking like $13,000, $14,000, $15,000 to get these things removed. That's insane to me. When the doctor did it to begin with, to me, that's malpractice, right? Like, you put something in somebody's body, it hurt them. That should be medical malpractice. Or at least if you at least covered the basics and said, listen, there's a lot of random stuff out there. There's some weird stuff that can happen if you get these things in. Just be aware of that. Are you sure that you still want to have these implants in? If yes, sign here, right? And then we'll put these things in. And we'll see you in 6 months to get them out. Like, these doctors are getting paid twice per surgery. It's like $5,000, $6,000 to do like breast implants, $13,000, like $20,000 just in making money off of making people quote unquote pretty and then making people sick and getting them taken out. So that's my little 20-minute spiel here today. Be careful going into the new year. I know a lot of women, again, you're trying to take shortcuts on being healthy. And I guess too, this does also expand into men who are trying to transition, which doesn't make any sense to me at all, but you're still at risk for all of these same things that I just brought up. And then if you do have double mastectomies, also be aware that you are increasing your risk of cancer by putting in implants. It's very important to know. Okay, so I love y'all. Thank you for tuning in here. I hope everyone has the best 2023 ever. Hope we're all healthy, safe, and whole. I'm out. Have an amazing day.